I'm Jack.
I'm Anna.
I'm Teal.
And I'm Maddie. And today we're going to be talking to you about coronary heart disease so you can provide better, more informed care for your patients. Coronary heart disease, or CHD, refers to conditions that affect the coronary blood vessels that supply the heart. It's also called ischemic heart disease, coronary artery disease, and heart disease. Coronary heart disease is essentially a result of a blockage in the blood vessels supplying blood to the heart, known as a coronary artery. If left undetected or untreated, coronary heart disease can worsen to a heart attack, which is when the blood vessel supplying the heart is suddenly completely occluded, causing tissue necrosis and ultimately death if not treated. The blockages can also cause angina, a chronic condition where patient experiences acute episodes of chest pain occurring periodically when the heart has a temporary deficiency in its blood supply. Approximately 3% of Australians have coronary heart disease, and it has been the leading cause of death since 2000. Cardiovascular disease, including coronary heart disease, affects men and women equally, but usually develops 7 to 10 years later in women than men. Having high cholesterol, high blood pressure, being a smoker, making poor diet choices, and being overweight or obese can increase your risk for developing coronary heart disease. These risk factors are modifiable, meaning that making lifestyle changes such as increasing your physical activity, having a healthy diet, and quitting smoking can all help to reduce this risk. Atherosclerosis is the buildup of fatty deposits in artery walls, causing narrowing and eventual occlusion, severely restricting blood flow, mainly a result of high cholesterol and a diet high in salty, fatty foods. While it can affect any artery in the body, including the brain, legs, or arms, once atherosclerosis affects the coronary vessels, coronary heart disease occurs. Risk factors for atherosclerosis are also risk factors for coronary heart disease, including high blood pressure, smoking, a diet high in fat and salt, having high cholesterol, or being obese or overweight. A healthy diet low in sodium and fatty foods, quitting smoking, exercise, controlling your weight, cholesterol and blood pressure can prevent atherosclerosis and coronary heart disease. How coronary heart disease will present. Angina, which is chest pain caused by myocardial ischemia, or the heart not getting enough oxygen. Discomfort may radiate to the neck, lower left arm or shoulder. Angina may feel like a pressure in your chest similar to indigestion or heartburn that tends to worsen with activity and is relieved by rest, usually only lasting a few minutes. Worst case scenario, coronary heart disease leads to myocardial infarction or a heart attack, where one or more of the coronary arteries becomes completely occluded and that area of the heart supplied by the affected artery is now no longer getting enough oxygen. This can lead to tissue necrosis or tissue death. Symptoms include persistent angina pain, shortness of breath, nausea, feeling lightheaded, and anxiety. Emergency treatment is required.
In 2014 and 2015, a projected 643,000 people, being 3.6% of Australian adults, were diagnosed with coronary heart disease. Out of these, 281,000 people had experienced angina, 428,000 had beforehand had a heart attack, and 55,000 had other forms of CHD. Participants in the study can report more than one disease. Furthermore, projected 108,000 adults had heart failure, which is a common result of disease such as CHD that damages the heart. Disease is more prevalent in older age groups. More specifically, it was 10 times higher in people aged 75 and over, as it was in people aged 45 and 54. A projected 65,300 people aged 25 and over experienced an acute coronary event in 2013 in the form of unstable angina or a heart attack. An estimated 200 events every day based on hospitalisations and mortality. Out of Australians aged 55 to 64 years, 8.8% reported living with heart, stroke or vascular disease. Prevalence increases with age. Self-reported coronary heart disease, specifically heart, stroke or vascular disease, was 17.1% in 65 to 74-year-olds, 26% in those aged 75 to 84 years, and 39.5% in those aged 85 and over. 19.5% of Aboriginal and Torres Strait Islander people aged 55 years and older reported having been diagnosed with stroke, heart or vascular disease. Coronary heart disease rates were 1.7 times higher in men than women. Cardiovascular disease progresses 7 to 10 years later in women than in men and is still the major cause of death in women over at the age of 65 years. Coronary heart disease was the leading single cause of death in Australia in 2013. In 2013, studies revealed that cardiovascular disease was the cause of 43,602 deaths in Australia and 19,765 deaths due to ischemic heart disease. In Australia, ischemic heart disease caused more deaths than any other single cause for both women and women. It also was the leading cause of death for Aboriginal and Torres Strait Islander people. in all states, with death rates up to 2.5 times higher than the rest of the population. Compared with non-Indigenous Australians, Indigenous Australians were 2 times as likely to have CHD, 4 times likely to be hospitalised for CHD, 1.6 times likely to die from CHD, and experiencing CHD at a younger age in the 35 to 44 age group, 4.7 times as likely to report having CHD, and 7 times as likely to be hospitalised for CHD. Compared with those living in major cities, people combined in remote and very remote areas were 1.6 times likely to be hospitalised for CHD, 1.3 times as likely to die from CHD. Compared with those living in the higher socioeconomic areas, people living in the lower socioeconomic areas were 2.2 times likely to have CHD, 1.5 times as likely to be hospitalised from CHD, and 1.4 times likely to die from CHD.
The multidisciplinary team is a fundamental component of healthcare, especially surrounding chronic disease. Well-designed and planned interactions with patients and the multidisciplinary team is a major contributor to high-quality chronic disease management. The detection of coronary heart disease is extremely reliant on the knowledge of risk factors of the patient, including hypertension, type 2 diabetes, smoking, and family history. CHD can be detected by nurses, GPs, or other allied health professionals who are aware of these risk factors and symptoms when talking to a patient. CHD is then confirmed through a variety of methods of diagnosis, including ECGs, a stress test, cardioangiograms, or computerised tomographies, most of which are conducted by either nurses or doctors. The use of a multidisciplinary team for decision-making regarding coronary heart disease has become increasingly popular in order to select the optimal treatment option for the patient. The first area of treatment of CHD is the management of lifestyle factors. This includes diet, in which the dietitian has a fundamental role in overseeing that the patient is getting the correct nutrients, exercise and weight loss, which can be improved with the help of OTs and physios, with daily exercises and stretching programs, as well as quitting smoking and reducing stress, areas which often come down to social workers and counsellors as well as nurses to provide education and methods of coping with these areas. Medications used for CHD treatment include aspirin, beta blockers, calcium channel blockers, and ACE inhibitors. This area of treatment is highly reliant on doctors who prescribe the medication, as well as pharmacists who are responsible for dispensing the medication and checking the prescriptions, and then their collaboration with nurses who administer the medication to the patients. Finally, CHD can be treated with surgical intervention, either coronary artery bypass graft or angioplasty. Both procedures obviously involve a cardiologist, cardiothoracic surgeon, and the intraoperative nurses in the operating room. Post-surgery, the multidisciplinary team is fundamental to the patient's recovery and rehabilitation, working together to ensure that the best possible outcome is achieved for the patient. The nurses aid in the delivery of ADLs and administration of medication. Physios and OTs are responsible for functional rehabilitation for the patient. The dietitians will ensure that they're receiving adequate nutrition and are educated on a healthy diet. And doctors and surgeons will oversee the patient's rehabilitation, providing routine checks and evaluation of the patient post-surgery. Overall, the communication and teamwork within a multidisciplinary team is essential to ensure that CHD is detected early within an individual and that the correct treatment and optimal rehabilitation is provided.
Today, as part of this presentation, I'll be talking to you about some current government policies, strategies, and a few handy guidelines which may help you care for or educate future patients with cardiovascular disease or specifically coronary heart disease. Firstly, I'll talk about some government policies. The Heart Foundation and NHMRC have partnered to create the Acute Coronary Syndromes Resource Exchange. This web page can be found here. This enables health professionals across Australia to share tools and resources aimed at improving the uptake of acute coronary syndrome guidelines and recommendations. There has also been significant investments in CVD research, with a focus on investigating the cause, effects, impacts and complications of CVD, which, as you know, helps develop evidence-based practice to optimise health outcomes for CVD sufferers. Finally, we have close the gap. This is an Australian policy that works towards equal and better access to healthcare for Indigenous Australians to provide a better health outcome for our Australians. We have a few government strategies, which is the Pharmaceutical Benefit Scheme, which continues to provide subsidies for a range of medicines used in the treatment of and or symptoms associated with CVD, so it releases the burden of cost. The Medicare Benefit Schedule, which is similar, provides subsidies for patients' care and includes Medicare items for the planning and management of chronic and terminal conditions. Eligible patients can also be referred by a GP for up to 5 Medicare subsidies and allied health services that are directly related to the treatment of their chronic condition, and in this case, cardiovascular disease. Secondly, that brings us to some guidelines to help improve chronic heart disease and CVD. The Australian dietary guidelines are handy, and you should familiar yourself with these guidelines and know where to direct patients, family and colleagues to for information, as diet is one of the greatest risk factors for chronic heart disease. Along with diet, smoking is also one of the major causes of exacerbated symptoms of CHD. It is a key to find alternatives such as cutting back or reducing the amount you smoke, nicotine patches or nicotine gum. And finally, total cholesterol levels. You should know the difference between low-density lipoproteins, the bad cholesterol, and high-density lipoproteins, the good cholesterol, where you can find them in your diet, and the healthy levels of cholesterol in your...
Thank you for listening. I hope you gained some valuable information from this presentation.